Coming up on 824 now, tomorrow kicks off American Heart Month. This Friday is National Wear Red Day. Each year, the American Heart Association and the nation come together with one goal: to eradicate heart disease and stroke. To tell us more about how you can show your support for the American Heart Association, we're joined by the AHA board member in New Orleans, Dr. Sheryl Martin Schild, this morning. Doc, good morning to you. The numbers that really jump out at you: 1 in 3 women live with cardiovascular disease, and then there's a rise among this in younger women?
There is, and it's a shame because most forms of heart disease and stroke are preventable with perfect blood pressure control and daily exercise.
How much of this is diet? You know, there's just so much good tasting food so available all the time, not a lot of it processed and not particularly good for us.
There's a large contribution from diet. You know, the high salt, high carbohydrates can drive high blood pressure and high cholesterol and diabetes and obesity, and collectively those contribute to the risk of heart disease and stroke.
So part of this effort by the Heart Association is that during February, so starting tomorrow, it's urging that at least one person in a household learn hands-only CPR. Why is that so important?
It's incredibly important because cardiac arrest claims way too many lives and too soon. And you know, if you can perform CPR on somebody who's having a cardiac arrest, it doubles or triples the chances of them staying alive. And so the most important things are to dial 911 and perform CPR, pushing fast and hard. But you have to know how to do it. And that's easy to do at cpr.heart.org.
And from what I've read, about half of Americans, according to the Heart Association survey, would actually perform CPR in an emergency, some because they don't have the training, and in some cases there's a lack of willingness or a concern about, you know, hurting someone more or even a liability.
That's true. It's a very scary situation, and if you don't come equipped with the skills and know how to do the job, you may hesitate and be passive about that and miss an opportunity to make a major difference for someone's rest of their life, potentially somebody that you love dearly.
So training obviously becomes really important?
It's incredibly important. In 2014, the Louisiana legislature passed the Burke-Cobb Act, which requires all graduating seniors to learn how to perform CPR. But that's an unfunded mandate, which means that the American Heart Association depends on donations from local organizations to support it.
So finally, again, to remind everybody, we have this rallying event, this National Wear Red Day on Friday.
Yes. You know, support the American Heart Association and the Be the Beat by posting on a photo or a video in action to your social media using the hashtag Heart Month, NOLA Go Red, or Be the Beat.
All right, Dr. Sheryl Martin Schild, thanks so much for your time this morning. Appreciate it.
Thank you.